Thank you, Dr. Neha, and thank you, Hindi team. Now we are moving to English session. Good evening and welcome everyone for today's session. Before beginning the session, we will have a silent prayer. Good evening and welcome every participants, those who are present here. And I'm really grateful for your presence and participation in International Forum for Promoting Homeopathy webinar. As all of you know, that International Forum for Promoting Homeopathy is continuously conducting this webinar for last 1679 days. Today is our 1618th day of continuous webinar. Really appreciating all of your presence and support for us. And today's our guest is Dr. Paul Joseph from Canada. He was working there for last 10 years. He worked as a professor in homeopathic medical college in Tamil Nadu before here, and he published many articles, and he is the author of book, and he wrote poem also. And he is a radio host doing talk shows, and doing talk shows in Canada also. And I'm very glad to invite Dr. Paul Joseph to our webinar. Doctor, you're welcome to International Forum for Promoting Homeopathic webinar. You're welcome. Dr. Paul Joseph. Sir, you can start now. What happened?
Is it audible?
Yes, you are audible, and the screen also visible.
Oh, that's good. Great. So, I welcome you all for the 1680th uninterrupted IFPH seminar. Really, I'm thankful to Dr. Manoj, Dr. Danesh, and Dr. Sajid Kudiat, and who is the today's Ajini Maliakal, right? It's very different. Yeah, so he is going to organize today. So really, this was a very interesting subject just now before in Hindi, but even though I couldn't understand Hindi, but I can, right? I came to know certain things he explained very nicely. Thank you, Dr. Mayur. Really, it is very interesting. And today's my topic is the power of pain. So I'm going to start with a story. Once upon a time, there was a king. He was a great king, great love with the people. He has great affectionate with the people of his country. He ruled very well. People were happy. And one day, the king, he prayed to the God, that his people were living with a very prosperity and wealthy. So he said to God, he was happy. At the same time, the people they are suffering from unbearable pain during various illness. Not only the illness, even during childbirth. So he prayed God to alleviate the pain. People they could not able to, right? What do you call the suffering, right? So God also took pity and accept his prayer. And king was happy because for the few days people are living happily without any pain. So the days goes, the time goes, and few weeks passed. A team of doctors came to the king And the king was surprised, and he asked what happened. Then the king was shocked by the news that the death rate in the country, it has increased a lot for the last few days, right? Then people were dying suddenly, but the number of people coming to the doctors also reduced because of there's no pain. And the doctors told the king they did not know why this happened. People are suddenly dying, and this was happened. These are happening like that. And the king formed an inquiry committee, right, to inquire what's going on among the people and what's happening there. There are the committee is headed by the senior doctors. King was appointed one senior doctor. Then doctors went into the country and they inquired the people. Then in that report of the committee, the doctor said that the past few days, people had no feeling of pain. And many patients, they did not feel any pain, even though they had serious illnesses in the body. They did not understand why this was happening, why these things are happening. Then immediately the king realized his mistake and he prayed God again, saying that he realized what is the necessity of pain. And the pain, it is a blessing. He understood that the pain is the blessing. So finally, right, then people started again getting pain. So this is that imaginary story, but it has the very important moral within that. That's very interesting thing. I think many of you understand, but right. So next slide. Today's topic is the power of pain. Pain is the vital body language. Everyone know that, right? This is the most important sensation that reflects as external manifestation that internally deranged in the human body or in any living organisms. So most of the living organism has feeling of pain, sensation of pain. So pain is the language. Through that, the patient, the vital force talking to the patient as well as doctors. That's very important. The pain that enhance the healing mechanism. Not only the sensation as it is enhance the healing mechanism, and the pain is an inevitable part of life. Everyone, right? At least many time or few times, right? Everyone has, touches, or it touches everyone at the same point. The pain is the warning sign, is the warning signal. When you understand the pain as a homeopath, right? Understanding the pain as a totality, which lead us to the correct remedy or simillimum. Apart from that, when the proving of drug in materia medica, right, the interpretation of pain is very important criteria, the important phenomena. Because when they prove the drug, the pain is the one of the most important language what the patient described. That's exactly that is in the same manner our pioneers, they recorded in the Materia Medica, then that the pain, then they form a repertory. So understanding of the pain is very important. So here the advanced birthday wishes to our master. So another, maybe after 2 days, we are going to celebrate our master's birthday. So this, I visited, it's about some 25 years ago to the France. I visited the tomb of our master. So I tribute him, and this is the picture. This picture, it's about more than 25 years ago, right? I do. The type of pain. HA robot, I think I think everyone know that, right? The Art of Cure by Homeopathy is our philosophy book, homeopathy book. We studied in the organon. Sorry. Again, the pain is the one of the experience from which the human life has ever striven to free itself. The pain in itself is the blessing in discuss. For it bring to the patient as a recognition of trouble, and to the physician the ability to recognize or understand the local remedies, or local melodies, or the location of the trouble. So that's why the pain is very important. And what is pain? So first few slides, we are going to discuss about the physiology of pain. The International Association of Pain for Study of Pain, they defined as the pain is the unpleasant sensory and emotional experience associated with the actual or potential tissue damage, or described in terms of such as damage. So that is very important, understanding of the meaning of the pain. When you go into the the etymology of pain, how the terminology derived, right? So in the 13th century, they describe, you can see here in the slide, the agony suffered by the Christ. And other meaning, it is a legal punishment of any sort, or is the punishment of penalty from God, right? So those days, they doesn't know the physiology and scientific ideology of pain. So that's why the people, they think that the pain is the punishment, from God, that we have to suffer. Then after the science developed, right? Then the etymology, the meaning has changed. Here you can see in the medicine what we studied, right? Pain is nothing but the signs of tissue damage or inflammation. Everyone you know that. The sign of inflammation, right? Dollar. Here. In 18th century, Charles Serrington was first introduced to the terminology of nociception. What is nociception? That we are going to discuss later. Then the side of inflammation, you know that, right? The Roman writer, see, in the 1st century, he described about, right, the 4 cardinal signs of, in pathology we studied, 4 cardinal signs of inflammations. The ruba, that is redness, the tumor, that is swelling, the choler, that is heat, then the dola, that is pain. Then again, the list of clarification for the of a complaint of the pain. When we deal with the pain, when the patient explain about the pain, then we have to go as a physician, as a homeopath or whatever, we have to go into a little deeper into the pain. The location of pain. That's why in homeopathy we say location, sensation, modality, concomitant, associated symptoms, and the radiation or extension of pain. So there are, in the same way, even in the Western medicine, they also describe it in such a way. So when you deal with the pain, that's very important, right? Acute and chronic pain, you know that. What is somatic? There are 2 classifications of pain, somatic and visceral. The somatic is nothing but the superficial pain from the skin or subcutaneous or some soft tissues beneath the skin. The sensation derived from there. But the visceral pain, that is from inner side, the internal organs, right? When they inflamed or when they ail, the pain, it's radiated right through our nervous system and it goes to the brain and we feel the pain. So there are a lot of things. Then the another criteria, that is a neuropathic pain. What is neuropathic pain? The pain that caused by a lesion or disease of the somatosensory system, right? Peripheral nerve system or central nerve system, whatever it's. The mainly if you consider the peripheral nerves, that may be due to trauma or due to any other secondary diseases, or example like carpal tunnel syndrome or sciatica, whatever it is, right? So like that, we classified into different types of pain or different the physiology of pain. Then the mechanism of neuropathic pain, if you go a little into deeper, when the damage happened due to an injury or disease or whatever, right? Nerve damage, persistent stimulation from the nerve damage area or from the location. Then the rewiring of the pain circuit, both anatomical and biochemically. This rewiring is very important. Our nervous system, I told you before, the pain is the one of the healing mechanism too. Not only the inflammatory mechanism, it is a healing mechanism too. So that's why the rewiring happened in the local area that extend to our neural system, and it goes to the spinal cord. From there, it goes to it reaches the brain, and from there, we feel the pain. Usually, we are not feeling the pain in the local area. The message through the neural circuit, it goes to the spinal cord. Then in the spinal cord, it understands that, right, from which the dermatons, the pain comes. We are going to discuss later all these things. Then through the tract, you know, we studied in the physiology, different tracts we have in the spinal cord, spinothalamic tract, right, like that. From that, it goes to the brain. From there, it goes to the thalamus and the other, our limbic system. And from there, it goes to the frontal cortex. So in frontal cortex, we feel the pain. That is the sensory area. nociceptive pain and neuropathic pain. All nociceptive pain are well localized, right? The neuropathic pains are not localized. It's a wide range of pain. In nociceptive pain, very sharp and worse in the movement. The other side, there are burning pain, shooting. The nature of pain, neuropathic pains are, I think everyone knows that, right? Burning, shooting, numbness, and tingling and needle-like pain like that. So there are a lot of things we can differentiate what is nociceptive pain and neuropathic pain. So most of the nociceptive pains are due to inflammation or the damage. The neuropathic pains are from nerve injury or in the internal organs problem or the abnormal firing or loss of modulation. So what are all these? That we are going to discuss later. So most of the nociceptive pains are physiological. Most of the neuropathic pains are based on the pathological background. So the pain is an unpleasant sensory and emotional experience associated with the potential tissue damage. There are a lot of neuroscientists, they explain. It is one of the human body defense mechanism. The pain is a very important defense mechanism. When the injury happens, when the disease happens, when the changes happen in the body anywhere, right, immediately that message, right, transported into the brain, and brain will take action how to heal the problem. And the other very interesting thing, the most of the scientists, they explain the pain is an illusion, right? Here in homeopathic point of view, we have a lot of informations. What is an illusion? Because all the other signs, if you take, for example, the other signs of inflammation, like tumor. So tumor is a visible, the tumor or swelling or enlargement, right? The collar, that is a heat that you can feel, right? Even when you touch, you can feel the hot or temperature increase or fever. But instead of pain, it is only a sensation, right? You can't feel. When you press over somewhere and you can feel the tenderness. But apart from that, the pain actually is just only the sensation, the feeling. Patient can, right, understand. So that's why it's called, in homeopathy, it's very important. Why? Because different sensation of pains, in thousands of different kind of pain, which is mentioned in our Materia Medica and Repertory. But as a homeopath, when we understand the different nature of pain, it leads us into the specific remedies, right? That is very important things. Here, some examples of pain illusions, right? Why it's called illusions? In phantom pain, for example, in experience of pain, if the patient amputated, right? When they amputated, even though after many years, patient feel the pain over there, but there is no leg or there is no limb, right? So that's called phantom pain. Then alonidia. What is alonidia? The feeling of pain, normally it is a non-painful stimuli. There are a lot of scientific experiment they did, right? Just without any pain stimuli, they apply in the in the experiment or in the laboratory experiment, even in the animal as well as the human studies. It shows even without the pain stimuli, the patient feel the pain. Why? Because of this, because of the past experience. The past, the experience which is already memorized in the memory. And hyperalgesia, so increased sensitivity of pain, even a little injury or little the pain, patient exaggerated more, right, like that. So then the terminology nociceptors. What is that? The specialized nerve ending is also called a pain. It's a pain receptor which is detects the pain. It detects the potential pain in the local area, and this stimulation goes to the spinal cord and enter into the brain. Right? That is a nociceptors. And this is very important in homeopathic aspect, right? The nerve fibers, types of pain transmission. Many times we think that why the patient feel different nature of pain, the burning pain, stinging pain, and pressing pain and squeezing pain. Why it's happened? Is that really it's happened? Right? So most of the time we confuse that, right? Pain is the pain, right? Why they feel different kind of pain, different nature of pain, even a different individual, they feel, right, in a particular one stimuli, different kind of patient, they feel different feeling. Why it's happened? Because of the the fibers which is responsible for the transmission of pain through the neural system. There are some examples they have given, right? That's the A delta fibers. They are myelinated nerve fibers that transmit sharp pain, localized pain, right? There are other kind of fibers that's called C fibers. They are unmyelinated nerve fibers. There's no myelin, right, over the nerve cells. So unmyelinated nerve fibers that transmit dull pain, burning pain, right, like a slow sickness. So like that, there are different fibers. Only they found out the few hundreds of fibers till now. But in the spinal cord, right, there are thousands of different fibers and tracts are, right, transmitting in various sensation from body to brain, brain to body, right? Then you know that most of us we studied in the physiology, right? Spinothalamic tract, spinoreticular tract. These are the main tracts which are responsible to transmit the transmit the pain to the brain. And also in the brain, the perception of pain, actual perception, actual feeling of the pain we feel in the brain itself. The thalamus. Thalamus is one of the important, right, the small area in the brain, which is act as a relay station. So from the different tracks, the pain comes, different nature of pain comes. So this thalamus identify which kind of or which nature of pain, whereas the burning or squeezing or throbbing or, right, everything, they are realized. The thalamus realizes itself and send to the message to the prefrontal cortex. So that is a very interesting mechanism when you go into deeper and deeper into the study of pain. Then the other one, the somatosensory cortex. where the cortex, particularly the somatosensory cortex, processes the sensory information, including pain, allowing the localization and interpretation of pain experience. Right? The thalamus recognizes the different kind of pain, and the somatosensory cortex, right, interpret the pain, then tell you, oh, this is burning pain, this is throbbing pain, like that. There are a lot of things, right, we have to understand. Okay. So when you go into the physiology of pain, right, okay. The sources of the area, the localized injury, or maybe due to various stimuli, the pain receptors on the right skin or in the visceral or internal organ or whatever, right, that discharge the impulses, that is in electrical form, electrochemical formation. It's emitted the electrochemical formation into the spinal cord. Then the spinal cord, that from there it goes to the right different, I explained before, right? Then finally it reaches to the prefrontal cortex. So actually the pain, that's why the illusion, because it's a energy. We can't see, right? Swelling we can see, redness we can see, the tumor we can see, but here the pain, that's why the scientists, they call it the illusion. Why? Because of it is an energy form sensation. This is a kind of electrical activity become experienced, then we feel the pain. So the same thing which I explained before, where the pain travels, right, from the local area, here the nociceptors, right, the pain sensory, what do you call, the pain sensory, the nerve endings, we can say, right? From there, it goes to the spinal cord. Before that, it enters into the dorsal root ganglion. So there are, the parasympathetic ganglion that is located in the spinal, right, beside the spinal cord. Right. From there, it goes to the dorsal horn cell. From there, right, the regular mechanism starts. That's also the same thing, right? The different thing. And the assessment of the pain. When you assess the pain, the patient verbalization and description of pain. When they describe the pain, as a homeopath, we have to very carefully, we have to write very carefully we have to analyze or understand. The understanding of the pain, that is very important. Why? Because when they explain in their language, because in Canada, so most of the patients, they talk in English, right? That's not the problem, because sometimes what kind of the language they are using, what kind of word they are using, right? Burning, if they have real burning pain, sometimes they said that it's a hot feeling. So we have to differentiate that. But in India and other countries, most of the people, they are going to talk in their own language, their mother tongue. But when you interpret the mother tongue to English, then English into the homeopathic repertory terminology or materia medica terminology, so it's very difficult. for some time. So that's why you have to ask more questions regarding that. Ask them, can you explain in such a way, with an example, what kind of the pain? Then they little think and it will go into their in deeper mind, and they explain very right. Where the language is very important. For example, I am telling, most of the time we confuse the pressing pain and constricting pain. Constriction also is a pressure. The pressing pain also is a pressure. But there are different medicine, you know that. What is the meaning of the pressing pain? The pressing pain, the exertion, the force, right, against a particular part. So here the pain. So the actually the force, the sensation and stimulus come from outside, like that. But the constricting pain, that's itself, the organ itself, the muscles itself, it's like that. Little tightening or fitting in. This is the construction. The pressing pain is from outside. The constricting pain within the particular, the local area. So there are a lot of, otherwise, the most of the time we end up in the wrong diagnosis or wrong remedy selection. And the duration of pain, then the location of pain, where the pain located, then the quantity and intensity of pain, right? Then the quality of pain, that is very important. Quality of pain, that is our character, nature of pain. Then the chronology of pain, how long, right? Then the aggravating and amelioration factors, then the physiologic indicators of pain, the other, right, symptoms, then the behavior, how the patient behave, and the effect of pain in their day-to-day activities. So these are the lot of things we have to understand when the patient comes. The assessment tool, what is the assessment tool here? So how to assess the pain? Usually in Canada, we say number. Tell me the pain, right? 1, 2, 3, 10, like that. Sometimes they say 5, 6, 7, like that. So we can assess in such a way. This is also the same, right? Wilda scale. Right. The word that patient described, the intensity of pain, the location of pain, duration of pain, then the aggravation and amelioration. The same way, even in the allopathic side also they consider that. Then the different sensation of pain, I explained already. The dermatons. What is this dermatons, right? Most of the time when you, right, this is the real, right, the nature of dermatons, how they, right, transfer the pain into different, from spinal cord, sorry, from the dermatons to spinal cord to the brain. Yeah, okay. Then the patient homeopath, right, approach. How we are going to deal with the pain. The homeopathic point of view. In homeopathy, totality of symptom is the foremost important thing in case taking, right? Here, as you know, that location of pain, sensation of pain, modality of pain, extension of pain, the nature of pain, the associated symptom, then underlying pathology. These are all we have to. Here, the pain as the key of the remedy or key of the individual to select the remedy. So location of pain, again, sensation, modality, causation, and extension. That is very important. In homeopathy, each and every, most of the drugs, most of the remedies, it has the direction of pain. Pain goes this way and pain goes this way, right? In clearly, very interesting thing, here see, in this book, there are two books I always refer, right, in case of when you want to describe the remedy on pain totality, these two books are very important. See, here in the book, the Rollin Greek, right? This is a very important textbook. Sorry, important, very small. It's maybe less than 100 pages. If you read, you can understand, right? Even in the Google, you can refer this book. This is the book, Illustrated Repertory, Pain in the Chest, Sides, and Back. Or their direction and the character of pain. You can see the pain from its extension or radiation of pain from different one part to another part. So most of the materia medica, right? They literally, they very nicely they explain where it starts, where it goes, from above downwards, or from below upwards, or from here to there, from here to there, from here to there. So different directions. There are different remedy they mention. So easily you can understand. Now meeting this is the front side, the anterior side, and the posterior side, posterior aspect of the body. You can see the bearing down sensation. You can see bearing down sensation, that is sepia, right? So they mentioned very clearly. And here on the posterior side, here I have at least in a month more than 10 to 15 patients of low back pain with sciatica. At least 10 to 15 patients a month, right? Sciatica and low back pain alone. Why? Because of the weather and the work and different kind of, the causation, the people come. And most of them, they clearly explain where the pain starts, where the pain goes, right? But overall, it's a sciatica pain. Overall, it's a low back pain. Overall, it's a lumbago, right? But in particularly, when you ask, right, you have to touch them and where the pain starts, where the pain goes. Some people, that pain starts from here, it goes like this. Some people, they say like that. Even in the gluteal region, there are different lines. You can see here, in the gluteal region itself, there are different, right? Just lateral oxalic acid. Then in the middle, calibic and dulcamera. Then calicarp. So there are different, right? You can see, very interesting. Even in the upper part of the body, where the pain goes and comes. Very interesting. Even the pain actually, it starts from the neck and it goes just over the scapula and down to the arm, right? I treated many cases, right? Berberis vulgaris, simple. Berberis vulgaris, we know that that's a only kidney remedy and stone remedy, right? You can treat well, right? Pain is actually, it starts from there and goes just over the scapula and goes into the axilla and goes down in such a way. See the other side, the lateral aspect of the body. Okay. Then this is also a very interesting thing. When you prescribe the organopathic drugs in case of pain, right? But you can select the accurate remedy, correct remedy or similimum. Along with that, the organopathic drugs also, which is very useful in case of chronic pain, in case of fibromyalgia or whatever, in case of the chronic pain, arthritis or whatever. See, the migratory pain from one part to another. Most of the time we know that lecaninum and pulsatilla, right? They are the leading remedies. Migrations, migratory pain or wandering pain. But along with that, the spasm and stiffness, tension in the local area, neuralgic pain, right? Stiffness kind of things. You can think of liver. This is from TCM. I always compare with the always the analyze with the TCM, traditional Chinese medicine, and the acupuncture and the homeopathy, right? So when the migratory symptoms or spasm or stiffness, you can think of liver. So you can prescribe little organopathic remedies to improve the liver. Then the burning pain, inflammatory pain, redness, wherever the redness always, right? Restlessness, chest pain and all, just heart remedies, right? Then heaviness, wherever the patient feel heaviness, even in heaviness of head, even heaviness of back, joint pains, swelling, right? Fullness feeling and distension feeling, the distension feeling, right? Enlarged feeling. You can think of a spleen remedy. And dryness and irritation, itching the lung, so like that. And whenever the pain localized, right, like a calibite, calibite, when the pain localized, tenderness, bone pain, lumbosacral pain, right, the sharp pain, stabbing pain, like with a knife-like sensation, pricking pain, needle-like pain, right, with the indicated remedy, you can give the kidney renal remedies. So that's why that's very important. I think time. Okay. Then when you go into deeper, little characteristic pain occurring any part of the body will often lead to the correct remedy. When you go into location, sensation, all totality of pain. That's called pain totality. Right. There are some specific remedies, for example, arnica, right? Bruised, right? Everyone knows that. Arsenicum, that's burning. The R.Hom, bone pain. Belladonna, throbbing, congestive pain. Bryonia, right? Cactus, constructive pain. Capsicum, again, the burning pain. Colocynth, pressure ameliorations, right? Tearing pain. So like cuprum, all CCC, convulsive, cramp, and coldness with a spasmodic pain. Colic pain, right? Diascoria, eupatorium, perfoliatum, bone pain, hypericum, ledampal, right? That's it's a stinging, right? Stinging pain, needle-like pain. Calibic also, the particular spot, spotting pain, right? Patient just explained in his or her fingertips, right? Calibic pain, or changing place from one place to another. And the calicap, most of the patients here in the low back pain, sciatica, I treated with calicap. Calicap is one of the best remedy for lumbar and low back pain. Then the calmia, you know that, right? Above downwards, ledampal from below upwards. Lycopodium, the other pulsatilla is again the wandering pain from one place, moving from one place to another. The same as lecaninum, right? Sebia, always the bearing down sensation. Spigelia, very shooting pain, right? Shooting or stabbing with the pointed instruments, that kind of. So lycopodium, you can see most of the time the modality, right? 4 to 8 p.m. Sudden. There are a lot of rubrics in the different repertories you can see, right? This is also, here, this is a book, very, very interesting book. Sorry. So this is a book. This is one of the Indian author, right? Dr. Santvani. Sorry, he wrote this book. This is a very interesting book. Here, he explained the real nature of pain and the remedy. The remedies maybe you must know, but we have to understand why the aching comes. What is the nature of aching? What is the nature of bearing down? How the patient explain, that is very important. Most of the time we fail into that. That's why, right, the homeopathy fails. Homeopathy never failed because when we fail, the homeopathy fails. Right? What is boring? How the patient comes and explain the boring pain. This book, this is very interesting, very small book. They explain the nature. So you have to, at least you have to, right, study this book 4 or 5 times. Then only you can understand. What is biting? Patient said biting pain. How the patient described in their language. Even in Hindi also he mentioned in whoever knows Hindi, because most of the patient and they explain in their language. Right? It's very difficult to understand the interpretation. Interpretation is very, very, very crucial things when the patient comes to describe the remedy. Why it's called, what is the nature of the breaking pain? See, disconnect or depart from something otherwise by cutting. So that is called breaking pain. So patient explain in their language. Right? It's a particularly this the knee joint, the elbow joint is I feel the elbow joint is right breaking, and it's some kind of feeling the cutting, and it separate from right the joints, the joint separation like that kind of feeling, right? It's a bursting pain. So there are a lot of the nature of pain they explain, right, that you can go through, because I think this book even available in the online too. You can study in the online too. The pricking pain, the pressing pain I already explained, right? Pricking pain. What it means? Piercing slightly, making minute hole and causing sharp pain. Right? When you insert in the needle, when you insert in the nail, that kind of right piercing, slightly, slowly it goes inside, and that's called the pricking pain. What is stinking pain? You know, when the mosquito bite, when the bee stings, the same kind of feeling. The patient will come and tell you, right? It's like the pain, it's like the bee stings. So there are, right, a lot of, really you have to go and you have to take this book and study, right, to understand the different language or different interpretation of pain to select the correct remedy. Most of the time, when the patient comes here in Tamil patients or Malayalam patients or Hindi people come, you know what I said? I asked them, and they explained in their language. Then I put it into the Google and translate into that. So most of the time we get the correct the format, the correct nature of pain. So otherwise it's sometimes it's not sometimes, most of the time it's very difficult to interpret the pain, right? Because each and every people, they have their own language, right? Even Tamil, if the Tamil patient comes, even different Tamil languages are there, right? In Kanyakumari Tamil is different, Coimbatore Tamil is different, Chennai Tamil is different, Sri Lanka Tamil is different. So like that, so each and everyone, how they explain, because they are the past experience. Whatever they had in the past experience, through that ideology, through that knowledge, they interpret their pain and explain. So don't believe as it is. So that's why we have to go into deeper and deeper, understand the pain and select the remedy. So like that. Okay.
Thank you, Doctor. Thank you so much for your presentation. It was really wonderful. And actually, you have started the session with a wonderful story to show the significance of the pain. Uh, the story itself gives the content of your entire class. Thank you so much. And all of us are neglecting the types of pain and all, even though we are thinking, okay, maybe they will they are feeling like that. That kind of guessing is happening in our practice. Actually, even behind the pain, we have to concentrate this much. If you are not taking this class means otherwise we don't think for that much importance for the pain. Actually, that is the purpose of IFPH also. Each one is specialized for each field. Our purpose is to share the knowledge together, and each of us are benefited. So I'm so thankful to you for your presentation, and I'm inviting all the doctors. We have only 2 minutes. With that time limit, you can ask your questions to Dr. Paul Joseph, and even if you have any questions, means you can put in the chat box, and he will answer you. And anyone of you, Dr. Danesh, what is your?
Really excellent, and congratulations, Dr. Paul Joseph. Yes, so you have mentioned about pain in different, what are the kind of pain and how it occurs and how it can be explained, how one can find the exact political language by using Google.
Yeah, that's a
That
Dinesh, that is a very important interpretation of the colloquial language.
we used to say that some Tamil people come and say, Doctor, I have tala vali. What is it? Tala, headache. We used to say.
Actually, many of us, we don't go behind the pain. So
Yeah. That's
importance
a
of that.
But at times there are conditions when somebody is feeling pain, but we are supposed to feel pain, but he is not feeling pain. In those conditions also, we have different remedies, just like painful conditions, painlessness of painful conditions. That need to be explained in a different way also.
And the other things I wanted to tell you, but maybe later we will discuss about the detailing. The fibromyalgia. Here in Canada, there are many people, they suffer from fibromyalgia due to various causes, right? Because most of them, they immigrated people from immigration from one country to another, right? They have to adapt to the situations, and a lot of things it's behind that. So that's why the people after 40, after 50, they started the pain, unknown, right? Unbearable, uncontrollable pain all over the body. That's called fibromyalgia. Very interesting, right? In that, so we have to understand the nature of pain. Different people, they are all fibromyalgia, maybe 100 people, but even 100 different among the 100 people, different remedies will come when you analyze the interpretation of their pain.
Exactly. There's an announcement for tomorrow, Dr. Ajani. That is, for tomorrow, we will have a session from Dr. Rashmi Shukla, and she will be discussing about modus operandi of homeopathic drugs.
Okay. Now it is the time to move to Malayalam session. Thank you, Dr. Paul Joseph, for joining with us and sharing your knowledge. And thank you, all the participants, for joining with us. Today, now we are ending the English session, and I'm inviting Dr. P. Shaila for moderating Malayalam session. Thank you all. Bye-bye. Good night.